A lot of times I have friends that are like, I want to be a doctor and take care of somebody that gets sick. And I think of public health, specifically the infectious disease side, is, yeah, that's great. I think about what happens when 7 billion people get sick. My name's Nick Kelley. I'm a research associate at the Center for Infectious Disease Research and Policy here at the U. As I was finishing up my undergrad in biology, I realized public health was what I wanted to end up doing. I had a passion for infectious disease and helping people. And as I started looking at schools and places to go, it became pretty clear to me that University of Minnesota was going to be one of the best programs I could go to. I came here and did my master's, worked on influenza-related issues for my master's project. I realized I loved what I did, I loved talking to people about it, and I wanted to teach. And to teach, I needed to get a PhD. And I've been working with influenza since I started here in 2006. One of the fantastic things that was here at the U is the biomed library. And I couldn't have imagined doing what I did without the biomed library. Going back to the studies from the 30s and 40s and digging into the archives that the U has, you can't find these things online, and we had them on the shelves. I even ended up finding a study that was done here at the U, one of the first influenza vaccine trials, and things like that. It was pretty exciting, and to be able to have those resources was phenomenal. And then those resources beyond that, with the other expertise we had here, like if there was a question about, well, this kind of testing or this study design or whatnot, you have to walk down the hall. I mean, there's the people here that are experts in those fields, so that it was kind of a one-stop shop for me to be able to do this huge review of influenza vaccines.
I first met Nick when he was an undergraduate at Luther College in Decorah, Iowa. At the time, he shared with me his love and enthusiasm for public health and infectious disease epidemiology. Anytime a young student like that comes forward, obviously it catches your attention. But in this instance, Nick already had a good sense of where he wanted to go and what he wanted to do. And it was my job to try to help him get there.
He's been my advisor and mentor through this process, and he's just phenomenal to work with because he's internationally renowned for his work on several topics, including influenza, but he's very personable and down to earth. It's one of those things where sometimes you wonder, he's internationally known, does that mean he's going to make time for me to work with me, to discuss, an abstract or simple things that I was doing, and there was always that time. He always made himself available to meet with me, or I see that with other students, and it was just that passion that he exudes for teaching and bringing up that next generation of researchers.
This fellowship really represents a real honor. This is one of the most highly coveted spots that anyone today in academia or government could try to achieve as a young, upcoming professional. I think it says a lot about Nick's, not only his current capability, but his future potential impact on a number of areas, including public health, epidemiology, the whole area of biosecurity, the government-academia interface. I have no doubt that Nick Kelley's career is just starting, and by the time he decides that he's done, he'll have made truly monumental contributions to the overall safety of the world.